Hello everybody, my name is Zhang. I am a PhD student in the School of Computer Science at Carnegie Mellon University. Today I'll present our work titled Stop the Spread, a Contextual Integrity Perspective on the Appropriateness of COVID-19 Vaccination Certificates. This work is in collaboration with Shvartzshnaider, Yuanyuan, Feng, Helen, Nissenbaum, and Sadeh. This work is supported by the National Science Foundation. COVID-19 has been around for more than 2 years and has changed our lives in various aspects. Since COVID vaccinations became available starting at the beginning of 2021, governments around the world have contemplated or adopted vaccination mandates and vaccination certificates or passports in a variety of different social settings, such as in large events, going to schools, in restaurants, gyms, etc. You may have used them at some point during the pandemic or are still using them now. Even though these vaccination mandates and certificates are not new, for example, vaccination mandates for children attending schools, yellow cards for international traveling, the sudden and unprecedented requirement to show proof of vaccination to gain access to public venues or engage in a range of daily activities has triggered a fierce global debate on the appropriateness of COVID-19 vaccination mandates and certificates, especially in light of established societal norms and conventions, perceived privacy harms, and civil liberty expectations. In our view, the privacy implications of vaccination certificate-related and other emerging technologies depend on the context in which they operate. For instance, while some people are likely to find vaccination certificates requirements acceptable to board a flight, but excessive for booking a hotel room or trying to rent an apartment, our study was conducted to develop a deeper understanding of what the respective societal norms are, and whether the information flows that these vaccination certificate deployments give rise to are indeed appropriate, with the help of contextual integrity. Privacy as contextual integrity is a framework proposed by Professor Helen Nissenbaum. It defines privacy in terms of the appropriate and legitimate flow of information, which is a function of conformance with established contextual norms, expressed in terms of 5 parameters. The 3 actor parameters: sender, recipient, information subject; an attribute parameter specifying the type of information; and the transmission principle parameter, constraining the conditions under which information flows. Contextual integrity posits that a potential privacy violation occurs when one or more of the information flow parameters deviates from an established norm. The theory of contextual integrity provides a practical and systematic way to study privacy and assess the ethical implications of data handling practices. We generated contextual integrity-based vignettes specifying the 5 parameters. This vignette survey method allows us to gauge the effects of contextual factors on the perceived appropriateness of these information sharing practices associated with common vaccination certificates usage scenarios. We reviewed existing vaccination certificate proposals, implementations, and relevant news articles. The vignettes used in our study include first-hand information sharing, where the sender presents or shares their own vaccination certificate information. We considered 2 types of use cases. First, when people present their vaccination certificates as de facto passports to gain access to places such as gyms, restaurants, stores, potentially on a regular basis. There are 21 such vignettes. In addition, we curated another 9 vaccine mandate vignettes pertaining to international traveling, in-person education, employment, and apartment rental. These 9 vignettes are based on relevant and debated contexts where people comply with vaccination mandates by sharing their vaccination certificates. These vignettes together reflect a wide range of real-world scenarios regarding the use of vaccination certificates. We also considered the subsequent resharing of the collected vaccination certificate information. In other words, the sender shares someone else's vaccination certificate information that they have collected in the first-hand sharing scenarios. We consider the resharing with a variety of different entities, such as the local and federal government, public health protection agencies, nonprofit organizations, and etc. Here are two concrete examples of what the vignettes actually look like. The top one is an example of first-hand sharing vignette, and the bottom one is a resharing vignette. As per the contextual integrity theory, it is important to specify all 5 parameters, which are marked in red. All questions are answered in the 5-point Likert scale in terms of their acceptance levels. As I mentioned before, our study used a contextual integrity-based vignette survey method. We recruited participants from the Prolific platform, using their representative sample option to recruit a demographically stratified sample of 1,000 U.S. participants based on the age, gender, and ethnicity of the 2015 U.S. Census data. To further ensure data quality, we excluded results from the 110 respondents who failed any of the attention questions. This table shows our diverse sample demographics. Let's look at some results. First, let's start with vignettes that involve using vaccination certificates as de facto passports. Recall that there are 21 vignettes across different recipients. It is clear to us, as shown in the graph, that there is no vignette where everybody feels uniformly about. Participants' responses vary across different recipients. On an aggregate level, 68% of our participants found these vignettes as acceptable or somewhat acceptable. The right part of the graph with the yellow rectangle is a box plot of the acceptance levels. Let's take a closer look at some of the vignettes. For instance, the top 3 vignettes with the highest percentages of being acceptable. They are assisted living facilities, cruises, and airlines, with at least about 80% of acceptance. Also, the box plot on the right showed relatively low standard deviations, which can be seen by the narrow width of the interquartile range. On the other end of the spectrum, these are the vignettes that are found to be the least acceptable, which involves showing vaccination certificates to access public transportation, government buildings, stores, places of worship, and apartments. These vignettes also contain the largest standard deviations. Recall that we also asked about 9 mandate vignettes. These 9 vignettes on an aggregate were accepted by 74% of our participants. The most accepted vignettes are about customs and border control agencies asking travelers to show their vaccination certificates to enter a country. About 85% of the participants considered this acceptable or somewhat acceptable. Pertaining to showing vaccination certificates to potential employers, for assisted living facilities or hospitals, these two are widely accepted by more than 80% of our participants, whereas vaccine mandates for a general job is significantly less appropriate. Let's look at some of the results involving resharing vignettes. Overall, the practice of resharing and repurposing of vaccination certificate information varied a lot based on the different recipients. Resharing with the public health protection agencies were considered the most appropriate among all these recipients, followed by the federal and local government or law enforcement, health insurers, nonprofit organizations, and other business entities. Overall, the practice of resharing and repurposing of vaccination certificate information is perceived as less appropriate compared with the first-hand information exchange in the original context. Even when we only consider resharing practices with public health protection agencies, we still found first-hand sharing statistically significantly more appropriate than resharing. As part of the study, we also collected free text responses accompanying the multiple choice questions. We analyzed these free texts using thematic coding. These responses and the themes showed that the ethical and societal values are indeed part of the normative assessment of the perceived appropriateness of vaccination certificates. We observed the weighing of public health interests against the expectations of freedom and privacy in many responses. A lot of participants reported viewing enhanced public health as a societal benefit. For instance, one participant wrote, "We need to take every precaution against spreading COVID. I am appalled that there are so many who don't want to get the vaccine. This is not fair to those of us who are willing to do everything we can to protect ourselves and those around us." Some participants were concerned about the potential harm brought by heightened surveillance. Some expressed concerns about their bodily autonomy, the violation of personal freedom, and the intrusion of privacy on their health information. For instance, one participant wrote, "Requiring a vaccination is not ethical in my view. At this point, the vaccine is under emergency authorization, not fully vetted, and may have awful side effects for some people who we don't know about yet. Also, the death rate is not alarming enough in this country, in my opinion, to require this kind of big brother approach to daily life. Imagine if everyone had to show an HIV test, what outrage would follow. Also, many COVID-related policies have severely trampled on our rights in this country, and many people have followed directives without questioning or critical thinking. So I worry about the very slippery slope that may occur if such vaccine policies become widely enforced." Others warned of potential discrimination against the unvaccinated and restrictions on their rights to access essential facilities such as government buildings and public transportation. For instance, one participant wrote, "This is completely unfair to those who need social services and the things at the DMV. Completely unacceptable and wrong. We have tons of people in our state with no internet access and no food, and they are afraid of science. They need these services." To conclude, vaccination mandates and certificates fueled polarizing and heated debates. We have seen that repeatedly in our surveys where both sides, either who are supportive of or who are against vaccination certificates, expressed very emotional responses and sometimes even curse words. Our work shows the untapped need for nuanced alternatives to societal challenges beyond a blunt one-size-fits-all model, such as an all-state ban of vaccination mandates or certificates by some states in the US, or requiring to show vaccination certificates at every place or for every situation. Our results show that contextual factors significantly affect people's judgments about perceived appropriateness of vaccination certificate deployments, which is also consistent with prior studies using contextual integrity in other domains such as the Internet of Things. Finally, our study illustrates how contextual integrity provides an effective framework for approaching controversial societal practices, such as in the case of vaccination certificate deployments, and potentially other challenges going forward. This concludes my presentation. Please check out our paper for additional and more detailed results. Thank you for your attention.